The evolution of family therapy has radically transformed our understanding of how families function, communicate, and heal. As future clinicians, understanding the historical foundation of family therapy will allow you to approach your practice with greater insight and a deeper appreciation for systemic interventions. Let's begin by defining family therapy. At its core, family therapy shifts the clinical focus from the individual to the entire family system. Rather than isolating symptoms within a single person, this approach asks us to consider how relationships, communication patterns, and roles within a family contribute to both wellness and dysfunction. Family therapy is rooted in systems thinking. It recognizes that no individual exists in a vacuum, and therefore, healing must often involve the broader system. The early development of family therapy can be seen as a response to the limitations of traditional psychiatric approaches. Psychiatrists working in hospitals and asylums often treated patients as isolated cases, detached from the relational environments that shape them. Thinkers from various disciplines, including Gestalt psychology, group dynamics, and role theory, began to challenge this view. They emphasized the importance of context, perception, and relationships. Virginia Satir was instrumental during this time. She described family members as playing roles like the placater, which preserved harmony at the cost of authenticity. These early efforts laid the groundwork for viewing the family as a collective system, not just a group of individuals. Next, we turn to the child guidance movement. This era, influenced by figures like Freud and Alfred Adler, sought to understand children's symptoms in the context of their family relationships. David Levy introduced the idea that maternal overprotectiveness could be a factor in child psychopathology, while Frieda Fromm-Reichmann described the so-called schizophrenogenic mother. Although these theories have been criticized, they shifted attention toward the family unit. Meanwhile, Bowlby's attachment theory and Nathan Ackerman's work in intrapsychic conflict underscored the complexity of emotional bonds between parents and children. Family dynamics and schizophrenia. A pivotal moment in the evolution of family therapy was the investigation into the role of family dynamics in schizophrenia. Gregory Bateson and his colleagues at the Palo Alto Project introduced communication theory to explain how conflicting messages, what they called the double bind, could contribute to psychotic symptoms. Theodore Lidz focused on marital discord, identifying patterns like marital schism and marital skew, where parental dysfunction created emotional confusion for children. Lyman Wynn expanded this work by identifying patterns such as pseudo-mutuality and pseudo-hostility, family behaviors that mask underlying conflict. These theories were revolutionary in shifting blame from the individual to the interactions within the family system. Role theorists and communication models. Other theorists, such as R.D. Lang and John Spiegel, emphasized the importance of roles and communication in understanding mental health. Lang introduced the concept of mystification, the process by which families distort reality to maintain control and deny problems. These theorists argued that understanding and clarifying communication patterns could reveal the roots of psychological distress. Marriage counseling as a gateway. Family therapy also grew out of the field of marriage counseling. Pioneers like Bella Middleman and Henry Dix explored the emotional dynamics between partners using psychoanalytic approaches. Later, Don Jackson and others brought forward communication analysis and object relations theory to understand marital dysfunction. These early marital therapists laid the foundation for what would become emotionally focused couples therapy. The pioneers of family therapy. Let's now acknowledge the pioneers who shaped the field. John Elderkin Bell is often credited as the first family therapist. Others, such as Don Jackson, Nathan Ackerman, Jay Haley, Virginia Satir, Carl Whitaker, Murray Bowen, Salvador Minuchin, and Ivan Bosormenianaji, each brought unique theoretical contributions. Their collective work transformed psychotherapy by advocating for a systemic lens that considers the family as an interactive and evolving system. They moved therapy from a purely intrapsychic model to one that embraces relational dynamics. Palo Alto contributions. The Palo Alto group, led by Bateson, viewed family interaction through the lens of communication. They proposed that symptoms often serve to preserve family homeostasis, that is, a kind of equilibrium, even when that equilibrium is dysfunctional. Concepts like symmetrical and complementary relationships, redundant behavior patterns, and scapegoating emerged from this research. This group introduced the idea of families engaging in strategic communication patterns, sometimes to avoid deeper emotional truths. Key figures and their contributions. Several theorists stand out for their distinctive contributions. Murray Bowen introduced ideas like triangulation and the differentiation of self. Nathan Ackerman emphasized bringing family conflicts into the open. Carl Whitaker believed in emotionally intense, co-led therapy sessions that encouraged authenticity. Ivan Bosormeni-Nagy advanced the concept of relational ethics, accountability, loyalty, and fairness within families. Salvador Minuchin developed structural family therapy, identifying patterns like enmeshment and advocating for second-order change where the structure itself is transformed. Other influential centers. Beyond individual theorists, various institutions played a major role in developing family therapy models. Centers such as the Albert Einstein College of Medicine, the Institute of Family Therapy in London, the Mental Research Institute in California, and the Milan Group in Italy each contributed new theoretical and practical innovations, from psychodynamic and communication models to systemic strategies. Discussion and reflection. Before we close, I'd like to pose 2 questions for you to reflect on and discuss. First, what are some of the motives for blaming parents, especially mothers, for the problems of their children? And what are the clinical consequences of this kind of thinking? Second, think about the roles you played in your own families growing up. What roles were expected of you, and which ones went unnoticed or unfulfilled? These reflections can illuminate how our personal experiences shape our perceptions as clinicians. To conclude, the evolution of family therapy represents a significant paradigm shift in mental health treatment. From early psychiatric institutions to today's systemic models, the field has continually redefined how we understand dysfunction, healing, and change. As future clinical social workers, your role will be to engage with families holistically, with compassion, with a systemic lens, and with a readiness to navigate complexity. Thank you for your engagement today. Let's now transition into an open discussion and hear your thoughts on what we've covered.